the Lanet Comprehensive School with their song Shangilia. Mheshimiwa Rais anapokezwa shati la maua, ishara ya kumkaribisha, kisha baadaye ataweza kutumbuizwa na shule hii ya Lanet Comprehensive School na wimbo wao kwa lugha ya Kiswahili, Shangilia Rais wa Kenya. Thank you very much. Thank you. Your Excellency, welcome to the official opening of the Lanet Regional Hospital and launch of the Ulinzi Prime Health Services Fund. Your Excellency, we shall commence with a word of prayer, followed by the unveiling of the plaque and the official opening of the hospital, and later a guided tour of the hospital. And now, Your Excellency, a word of prayer from the chaplain.
Which now provides specialized services and based off in the base locations. Historically, we have always had one referral facility, the Defense Memorial Hospital, which is a level 5 facility. And all patients were being referred from level 1 to 3 to the level 5. But in the recent past, the recent modernization expansion of our medical services, we have seen the establishment of 4 regional hospitals, one in Eldoret, one in Isiolo, one in Nairobi, and the latest that we have just launched here today. Okay. The distribution of these services have really revolutionized care because what we used to refer to Nairobi is now being managed within the regions, bringing services closer to the people and the quality of care much better, reducing the burden of care in the Defense Memorial Hospital, and even reducing the referral costs. We also hope to have, this is the Defense Memorial Hospital. This is a typical Lanet regional. That's our defense in Memorial. And we hope to complete our level 6 facility in Kapete. And the process is underway to identify partners to complete these facilities. For these facilities, is a 3-story building. And on the ground floor, it has this. We are right here, Your Excellency. And to my immediate right, it is in grid, is our consultation areas. And on the left is our laboratory and pharmacy. Behind me, on my right here, we have the X-ray department and other things that they put in the diagrams. On this first floor, we have, as labeled here, sir, we have the private wings, and we have the maternity unit, the ICU, operation theater, and the female ward. On the second floor, we have largely wards, and most of these are replica of what is the first floor. Correct. For this tour today, sir, I would request you to visit our first floor, where we have our ICU and our dialysis unit and the maternity unit. These services available here is actually, I think, in this country, the scarcity of ICU beds within the region, the dialysis unit, and a special unit within the maternity, the newborn unit, is going to bring better care to those living in the around the region and in the community at large. And as you open these services in the civilian community, it's a plus in the Nakuru region, sir. Welcome to the thank you.
patients now here, or we started to use the hospital?
We have one patient managing.
Okay.
We have not shown them over, but I have one already. I managed to in the dialysis unit. The one key feature is that we are using the services of both military and civilian, or non-military officers and nurses, and you encounter most of them. Yes, sir. And to get to introduce to our non-military organizer, Dr. Kamau, and her team of critical care nurses. So this, Your Excellency, is a 6-bed intensive care unit where you manage critically ill patients. The main feature in this is that patients are able then not to breathe on themselves, and we give them ventilator support. Currently, we have 2 ventilators for this unit. Professor Azanda to acquire the other 4 to complete the establishment of the entire ICU. For this ICU, again, as I said, within the county, you have 6 beds that are in the county referral hospital. The addition of these other 6 beds is not only a plus to the KDF, but the community out here in Nakuru. Now, to talk about the special feature of this ICU, sir, I would like Dr. Kamau to talk about this particular ventilator that gives a special feature within this ICU.
Thank you, Excellency. So I will just go to highlight the features of this particular machine that I have. Firstly, we are able to ventilate units as small as 200 grams. So that allows us to be able to give care or ventilatory care to preterm babies who may require it. Secondly, these ventilators have what is called adaptive support ventilation. That means they use artificial intelligence to be able to meet the patient's needs. So they're dynamic in that whatever the patient needs is what the ventilator delivers. So that allows us to give our patients optimal comfort. It also allows us to provide particular personalized mechanical ventilation. And finally, it also allows us to potentially reduce the risks that are associated with ventilatory support. Yes.
So how do people pay for this service?
For the KDF personnel, the service is comprised. We offer 3 services to our KDF personnel.
Okay.
We intend to open this up to the civilians, for a fee for service through what you're going to be launching later, sir, within the private services. We want to open up for those who have insurance, they can always access the service.
Very good.
Is what you are going to launch. What is the house fund? So when you are set.
There should be a 4-bed dialysis unit, a 4-machine dialysis unit. And this is the dialysis machine that we are talking about here. We have 3 currently, and the process is underway to acquire the 4th one so that we are complete. Just to compare what we have in the county, sir, we only have about 19 such machines that are functional, with a population of about 2,300. They struggle to get these clients to have dialysis. The cost of dialysis also, the community there may not be able to access these machines without that competition. So introduce these 4 machines here. We are giving an extra facility to the community, not just to KDF. This particular client you asked me about, or the other client, has been traveling to Nairobi twice every week, every Monday and every Wednesday. Every Monday, Wednesday, and Thursday. What will happen is in his eyes, even as he have the facility. And do the 3rd session on Friday. Deduction of costs of travel and overburdening the facilities, and you're going to access this also to others in the community within us. For today, sir, we had requested registered by the council. It's also SHA accredited.
And then number 2, we have a program. We have a program with the Ministry of Health. You need to talk to your colleague at the Ministry of Health. We can support you with equipment under the program. We do fee for service, so that some of the expensive equipment you don't have to buy. Yes, sir. The manufacturers, they come and put the equipment here. Yes, sir. And you only pay for to use. For every usage, there is a fee, and that fee can also be paid for by SHA. So it will make it easy, so that you don't have a heavy overlay of finances. You know? Because instead of, and you see, what we have agreed with them is that they will place the equipment, they will service the equipment, so that we don't have this problem that all the machine are Arabica, and we wait for a month, 2 months, looking for spares all over the place. It becomes the manufacturer's responsibility to make sure that the equipment is working, because that is how he will make money.
We are going to engage.
Yeah.
We start.
You had actually guided as such.
Yes.
We had an issue meeting with the PSC of health. So we are actually progressing what you had guided.
Yes. And already, I think 20 county hospitals are have those facilities. So we are, you know, it's another way of innovation. Yes. You know, the manufacturer wants somebody to use their equipment once they have manufactured. So we are, but also when you don't have money, you cannot buy. So he's stuck with the equipment, we are stuck with the patients. So it's a win-win. It's a win-win. Yeah. So I think that would be my other advice.
We'll explore that.
We have engaged actually now. We are now coming with the SHA now. It will be much easier to pay those equipment. We have engaged. We are at advanced stage since you guided us the other time.
Now, Your Excellency, before you leave, I want to invite you for a demonstration of how that linkage with SHA through Taifa Care.
Okay.
Yeah, right here, sir. Right here, sir.
Oh, sorry. Oh, yeah.
We have already deployed RPKE in this facility, and we are paperless. And I have a team here from the digital health agency who have deployed this system here. Definitely to take us through a small demonstration of the
So the admissions now are paperless. Because you see, that documentation on paper is the one used to bring us very many complications with claims, with fake claims, fraudulent things. But now, you know, when somebody is identified, either we are moving, of course, to biometric, but now by ID. So when somebody is their ID, we make sure that there is, yes, you identify them, and OTP. Because now OTP makes sure that this is the person who is carrying the ID. So it is, it's helping us remove unnecessary fake people. So, thank you.
So, Your Excellency, sir, I am Dr. Joyce Wamishe from the Digital Health Agency, and together with me is part of the team, the product development team, represented by Jared Onsomu and Marvin Gondi. And it's like you were with us when we were developing this demonstration. So Taifa Care is what we are rolling out, and it's a user-centric solution that is integrated to the digital health superhighway. We have been at this facility for the last couple of days, training the staff. They are really enthusiastic about it. And we've also been configuring it to be able to see both military personnel and civilians who are SHA eligible. So the plan is to have this system deployed to all the military health facilities countrywide, and we are looking forward to this particular facility being the model facility that goes paperless. As you've alluded to, This is the homepage, but you have rightly described the identification process. So we ask for the national ID, and I'm describing for the civilian that are SHA eligible. We ask for their ID, and we are definitely making sure that we are not dealing with a ghost. We are dealing with the true person that we want to serve. We also can see that they are SHA. Exactly. And then after that, they have registered and done, they're eligible, they can get services under SHA. After that, we queue them to the triage. And then at triage, this particular system has got clinical support alerts. For our patient today is Marvin, a 32-year-old male, and we can already see once we put he has fever, so the system is even saying this person is febrile. We are also able to see that this is a person who needs to be fast-tracked in terms of triage compared to somebody who's a bit more stable. Then we take them to the consultation room, where we can see this. We had pre-filled this, but we can see that we can see the patient physically, and we can, today we put in some more information at about 5:50 a.m. And here the clinician is able to take care of the patient, do a very good, and then do any lab radiology. The history, so the patient will give us the history. The past histories, they're already in the system. And then when they come, exactly. That exercise book imepotea. Hakuna makaratasi. Exactly. Yes, exactly. Inararuka. Exactly. Yes. Yes. Exactly. Yes. Mm-hmm.
So you have the benefit of that history.
Yes.
Right
at this, exactly.
People
You're very right, sir. We actually say we want some.
there are people who have an argument with this thing.
Oh. Yes, we want someone to give their history once, and then after that, it's just building. Exactly. So for today, it's a short patient journey. We then prescribe some medication, and then the patient goes to the pharmacy without any paper, no prescription, and finds the pharmacy. The pharmacy view is like this, and the pharmacy is able to dispense. Now, Your Excellency, after that, the patient goes for discharge from the patient journey to billing, where another OTP is done to say now the patient journey is complete, and then the bills have been accumulating as the patient moves from one service delivery point to another. So at the billing, the patient is discharged from the patient journey, and then the various bills are put together. There is some verification before we move it to the SHA for processing. One of the hallmarks, Your Excellency, for this system is tunasema data mkononi. So this is a dashboard for the facility. So the leadership will definitely appreciate this kind of dashboard, because the CMO will be able to know how many patients have come over today and over the past 7 days, and we can even configure over quarter, over the last 1 year. We'll be able to know our patients who are coming, what are they sick from, you know? Here, yes, exactly. So the bigger the writing, the more common it is in this facility. And we can even do this for surveillance. So like, remember the time we had COVID? COVID most likely came even before that March. We would pick it with this system earlier. When it comes to collections, we have, as I said, we have configured to be able to see military, but now we also have SHA, and we can be able to see the collections via whatever scheme that the facility is having. Mm-hmm. Exactly. Spot on, Your Excellency. Here is the pharmacy place where you can even see how many of those prescription orders have been fulfilled. So you're able even to know which are these medicines that are not being fulfilled, and we need to get them in this particular place. So with that, Your Excellency, we definitely feel your leadership. We really, really appreciate, and that's the end of this small demo. And we look forward to this facility being paperless and guiding the way for the other military health facilities. Thank you very much.
I'm very happy with this.
Thank you.
This
Thank
is
you,
what
sir.
I want.
Thank you, sir.
And it's going to happen.
It definitely will happen. Yes.
Yeah. Makelele aside, this will happen. Okay, thank you very much.
Thank you so
I'm
much.
sure the people who have been handling papers, I'm not hearing them talk.
Your
The
Excellency,
people
we
who
are
have been
here.
handing around these papers,
We are more than excited. We have trained every member of staff.
Yes.
We have brought out the system.
Yes.
And we are happy that we don't have to lose prescriptions today. Whenever whoever gets medications from this facility only gets that which has been from the system.
Yes.
There are no side
There are
groups.
no side manenos.
No side manenos here. We are more than happy, Your Excellency.
You are place to place, so, yeah,
The beauty of the system also is that you have visibility of this across the regional hospitals, so that a patient senior, the file is available in the other regional hospital. Yes, sir.
Dr. Lanet is from the Ministry of Health. She started her journey in our hospital.
Okay.
She's our intern.
Okay. Okay. Very good. Very good. I was talking to your team, the DHA team, last night. Just trying to tell them how to configure so that we can be following the numbers. So it is moving very well.
We now transition to the launch of the UPHSF fund, sir.
So this fund, this is a national government fund which was approved by the cabinet, and it has also been approved by the National Assembly so that we can contribute to universal health coverage by attending to civilians in our level 4 to 6 facilities at AFISA, primarily through Social Health Authority, private insurances, and other schemes. Yes, sir. Our clientele will be civilians, varied civilians. Even Mama Mboga will be able to attend here, sir. Then this, yes, sir. Yes, sir. Then we have the level 4s, sir. We have 6 level 4s currently, as listed here. Then we have Defense Forces Memorial Hospital and our envisaged level 6. So this facility, this fund is governed and administered by the Defense Council as the supreme organ, which gives the policy direction. And we also have an advisory board, sir, which gives technical advice. The advisory board is chaired by the Principal Secretary, who is also the administrator of the fund, Principal Secretary, Minister of Defense. The senior most person there after the Principal Secretary is the Director of Medical Services, who is a uniformed personnel. So we also have diverse technocrats from other ministries. We have from the National Treasury. He's out. He sent his apologies. He's in Wajir on another assignment. So we have the DG, Minister of Health, Dr. Patrick Amoth, who has graciously visited us today. And so we also have the Director, DG. Then we have Director of Military Veteran Affairs, representing the veterans, Brigadier Leriari. We have the Chief of Finance, who is also there. And then sir, we also have the non-uniformed personnel, who led by our Director of Human Resource Development and Management, Madam Dr. Nzavi. We have the Chief of Medical, sir, also there, gracious. And we have the Senior Chief Finance Officer. They are all available here, sir. They have really guided us in the initial preparation of this launch. So the Secretariat is headed by me at the moment. Sir,
Do you mind some feedback?
anytime, sir, anytime.
Unless, do you have a reason why you have the prime there?
The prime, sir, is essentially because it will be superior service. We are anticipating superior.
Superior service is not in the naming.
Yes, sir.
It is in the doing.
In the doing.
We want to offer prime healthcare to the civilians.
But yes, but it is in the doing.
Yes, sir.
I because you see, I'm just seeing the way UPHSF
Yes, sir.
is a bit mouth.
It's mouthful.
So just think about it.
Guided, sir. Guided. So we have
Yes, Patrick, how are you?
the Director General. Dr. Nzavi, Dr. Ngundo, then Mr. Mutuma, Senior Chief Finance Officer. Sir,
How are you, Professor?
our stakeholders, sir,
Yeah.
is the CEO,
Hello.
then Brigadier Limo from Defense Force as well, sir, and from Defense Forces Medical Insurance Scheme. Sir, after that, we request, sir, that you press on the buzzer so that we can unveil the plague.
And now, His Excellency will launch the fund in 5, 4, 3, 2, 1 now.
To the civilians.
But yes, but it is in the doing.
Yes, sir.
Because you see, I'm just seeing the way UPHSF
Yes, sir.
is a bit mouth.
It's mouthful.
So just think about it.
Guided, sir. Guided. So we have
Yes, Patrick, how are you?
the Director General. Dr. Nzavi, Dr. Ngundo, then Mr. Mutuma, Senior Chief Finance Officer. Sir,
How are you, Professor?
our stakeholders, sir,
Yeah.
is the CEO,
Hello.
then Brigadier Limo from Defense Force as well, sir, and from Defense Forces Medical Insurance Scheme. Sir, after that, we request, sir, that you press on the buzzer so that we can unveil the plague.
And now, His Excellency will launch the fund in 5, 4, 3, 2, 1 now.
We've made about 50 million.
Oh, very good.
Yes, sir. So I will request that we take a photo, you on this side. After the lights, sir, we wait for this. Yes, I will take a photo. Thank you. Thank you, sir. The PS, you on this side, sir. DMS, sir. Dr. Patrick Amon. Thank you, sir. That's the end of the tour. Thank you, sir.
Thank you very much, Your Excellency.